All right, want to bring in Dr. David Samadi. He is the head of men's health at St. Francis Hospital. He's been great on this issue. Doctor, welcome back. Nice to see you.
Thank you, Greg. Thank you.
And the other night we were talking, and you wanted to talk about stadiums. Stadiums right now, sports arenas, major facilities that are not being utilized because of the coronavirus, you think can be utilized as temporary hospitals for coronavirus patients?
I think we need to really get ready and prepare ourselves, because if you think about this, the eye of the storm, Greg, is going to be coming to us in about maybe 10 days to 2 weeks. That's when the real tsunami is going to hit our country. Because if you look at the curves from the Europeans, from South Korea, and from the Iranians, and you follow the same kind of trend, you can see that that's coming up very soon. We're about 2 weeks behind. So what's going to happen? Our healthcare system is going to be overwhelmed. And the way to do this, in my opinion, is to really take the patients with corona to exclusive centers that are dedicated with respirators, ICU beds, nurses that are absolutely trained in infectious disease, and they have the hazmat suits and they really know how to take care of this, instead of even bringing them to the hospital. As you mentioned, we have all these stadiums, basketball courts, buildings that are empty, and we could very quickly turn them into major ICU triage corona centers. And that does two things. We're talking about the social distancing. We should be also doing patient distancing. Keep the healthier ones in the hospital and make sure you divert through all the phone systems that we have and apps and other teleconferencing. Bring the patients to these corona centers and take care of them. I think that's really very smart.
It makes sense. I think you've got to get the word out, because the public is going to have to get used to that idea. I know you don't want people to panic. You've mentioned that throughout this crisis, but the idea of going to a stadium sounds like for healthcare, that's foreign to us. That's something we're not used to. I think we'll need to get used to it, and we got to get the word out there and perhaps prepare the public. Let me ask you this very briefly. Italy and what they've gone through, I keep hearing, and I think you alluded to that, we're only a couple of weeks behind them. What's happening in Italy can happen here. I'm not sure is that 100% true, because my understanding is our systems, our healthcare system, even our people were better prepared for something like this.
There's no question that we have probably a better healthcare system than Italians. But the bottom line is this is all about the numbers game. So what happened in Italy, in fact, if you look at the number of beds that they have in South Korea, is about 12.8 beds for 1,000 patients. In China, it's about 4.8. In Italy, it's about 3.2. And guess what? In the U.S., it's 2.8. So you can argue that the Italians have more number of beds per patient than we have, even though we have more ICU beds. But what happened in Italy, number one, the population are older, which is exactly what this virus is going after. The social distancing didn't happen on time, and it was slow until the curve really spiked, and they caught off guard. We don't want this to happen. And that's one of the reasons why, Greg, we need to prepare our beds. We need more ventilators, we need more respirators, and we need to clear a lot of the patients. 70% of our beds are already occupied by flu patients. So getting them out and getting prepared is absolutely the way to go.
Dr. Samadi, makes total sense. Thank you very much. One other thing the Italians do more than we do, smoke. Much greater rate of smoking in Italy than in America. Dr. Samadi, thank you very, very much.